Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today I want to talk to you about the reality and actually how incredibly common it is, even though we don't talk about it, and even though there's reasons why we don't often see this as frequently, and that is the reality of individuals struggling and suffering with hip dysphoria. Hip dysphoria is oftentimes, I see this in individuals who identify, you name it, whether you identify as trans femme, trans masculine, non binary individuals. Hip dysphoria is absolutely a real thing. And one of the reasons why I don't often see people talk about hip dysphoria is because, especially for individuals who are trying to masculinize or individuals who present more non binary, people will often go for and talk a lot about the distress of having um, chest dysphoria. And because chest dysphoria is something that is a little bit more accessible in the sense that insurance is more likely to cover it versus hip dysphoria. Not a lot of insurances cover body contouring procedures, which fall hip modification or any kind of modification around the area of the hips is going to fall into body contouring procedures. Insurances are still not covering those. They're more likely to cover genital surgery and breast augmentation and mastectomy procedures, which are top chest procedures. And as a result, we don't really hear, or we don't even a lot of times think or have a capacity to understand that, or not necessarily capacity to understand, but we're not even aware, that's a better way to say it. We're not even aware how many individuals are actually struggling with hip dysphoria. I actually had people tell me that it's not even their chest that is giving them distress as much as it is their hip area. Again, that is a body part that is very stereotypically gendered in particular way in our society, just like chest part as well, and a lot of other parts of the body. But this is a special one because it is right there, it is visible, and can be difficult to hide. So hip dysphoria can be really challenging for individuals to live with because there's only so much you're going to be able to do. And even with the hormonal treatments, there's only so much changes you're going to experience and see in your body as adults. This is why a lot of individuals go for body contouring if they can, especially out of pocket. Like I said, insurance doesn't really cover it up. But for a lot of people, that causes quite a lot of distress. That causes quite a bit of dysphoria to the point where people really struggle to leave their houses, or people really struggle to socialize or to be around other folks because the dysphoria around that area is so present that you really don't want to be visible. You don't want anybody to see you, and you don't want anybody to see your body. Other things you can do if you're struggling with hip dysphoria. I think a lot of people are kind of doing those things in the sense of, if you feel that medical transition is for you as adults, you already probably, perhaps if you're interested in that, you're already on hormones, and some element of that is going to help. But apart from that, people will sometimes, in my experience, engage in particular exercises to slim up or to modify physically through the particular types of physical activity that they can do their hip area. Of course, you're not going to change the structure of your bones, but you will change some composition or elements of composition surrounding the hip. There's some people who will work with stylists that will help them to either accentuate that area, if that's what you're looking for, or actually to de-emphasize that area for you as well. But apart from that, it can be very, very challenging, especially for some individuals who just very strongly suffering with dysphoria in that area. And there's really no one answer. I wanted to make this video because I wanted to vocalize it. I wanted to vocalize this because I want more people, because I know that my channel is being watched by providers as well. I wanted more people to realize that this is an area of dysphoria that sometimes we neglect to discuss or to assess for when we're working with individuals. We're so prone to thinking about transgender surgeries as surgeries to the face, surgeries to the chest, and surgeries to the genitals. We seldom think about other procedures and the fact that there's people that suffer and have very strong dysphoria in relationship to the body part. But hip dysphoria, and I bet a lot of you will comment who experiencing that, it's absolutely is definitely a deal, and a big deal for a lot of people, and for a lot of adults. I work with it also for a lot of adults who are experiencing it. So it can be very, very difficult, very challenging, again, because we live in societies that genders that body part so much. So I really wanted to make this video also not only for providers, but most importantly for anybody out there who's watching it, who finally feels like you're being heard, who finally can say, okay, yes, finally somebody is vocalizing this for me. Somebody's actually saying that, hey, this is real, and I'm not just making it up. No, you're not making it up. There's a lot of misconception in regards to gender identity, and transgender identity specifically, that suddenly you are on this bandwagon for any kind of surgical procedures, or that all the providers are there to cut up your bodies, mutilate, I hear a lot, to cut up your bodies and make money off of you. And I think that's really, really, not only is it inaccurate and not true, but just is really misinformed. I think that what's important is to be able to understand and be aware how certain elements of physical body can cause distress and a severe dysphoria in individuals, and how other elements do not. This is why sometimes we see individuals who are totally fine with their genitals, but have very severe chest dysphoria, and vice versa. So there's no one person experience that is going to be alike to somebody else's experience. So if you're watching this and you're having a hip dysphoria, and you as adults started to think that maybe this is something your mind is making up, chances are your mind is probably not making it up. And if it's giving you distress because it's in a relationship to your gender identity, then there is absolutely gender dysphoria, and something to think about. Again, there are definitely out there people who will help trans folks to emphasize hip area without any surgical interventions. People don't have to go through surgeries. So there's also fitness trainers who can help you understand better how to maybe work to, again, de-emphasize or emphasize that areas. But yeah, it's, dysphoria, like I always say, is such a beast. It's such a monster. It strikes different body elements, different physical aspects of individual differently. And in some cases, it is hips, in other cases, it is chest in individuals, in others, it is genitals, in others, it is face. Some people have incredible facial hair dysphoria. Some people have incredible dysphoria because they have lost their hair. So it's very individualistic, but hip dysphoria definitely does exist. So think about if you're struggling with it, and it's really affecting your quality of life and really preventing you from going out there and socializing. Look up, see if you can find ways on internet that help and teach, maybe a YouTube video to de-emphasize or emphasize, whichever one you really want to bring into your sphere of existence, and see if you can learn something from this video. So comment below, let me know. What is your relationship to, are you struggling? Do you find yourself struggling to hip dysphoria? I know that, again, it's not often spoken of topic. Comment below, let me know, and I'll see you all next time. Bye.